All right, welcome everyone. If you're here to really sharpen your clinical skills in cognitive behavior therapy, well, you're in exactly the right place. We're going to treat this as a really practical masterclass, breaking down those foundational skills you absolutely need to be an effective CBT practitioner. Okay, let's dive right in. Before we even touch on a single technique or intervention, I want to start with this. This quote is everything. It's the bedrock. Because beyond all the models and the manuals, the most powerful tool we have is our ability to just connect human to human. It's a great reminder that the foundation of all effective therapy is that relationship. So let's start right there. The first, and I would argue the most critical component of CBT, is establishing a strong therapeutic alliance. The research on this is crystal clear. A positive alliance is directly linked to positive treatment outcomes. This isn't just a nice little extra. It is a clinical necessity. So how do we actually build it? Well, we focus on these 4 key actions. First, you've got to demonstrate impeccable counseling skills. Your empathy needs to be genuine and felt. Second, you have to be transparent. Share what you're thinking, your conceptualization, and then ask, hey, does that ring true for you? Third, make it a team effort. You're the guide, for sure, but all the decisions are made together. And fourth, and this one is so powerful, constantly seek feedback. See, these actions aren't just a checklist. They communicate these powerful, implicit messages. When you consistently do these things, you're telling the patient, you're safe here, I am competent, and there is hope. You're moving way beyond just simple rapport, and you're actively building a clinical environment of safety and real optimism. Okay, so once that alliance is starting to form, the next layer we build is structure. Now, a clear session structure, it isn't about being rigid or cold. It's about providing a predictable framework that actually makes therapy feel safe and efficient. It really helps the patient understand the whole process and feel confident in the plan we have. And this is the classic blueprint, a really reliable format for every single session. You start with a check-in, you set an agenda together, and then you dive into the core work of discussing problems and teaching skills. This then leads very naturally to a homework plan, and you always end by summarizing and asking for that crucial feedback. Now, here's a real-world tip that I find a lot of new therapists struggle with. To maintain this effective structure, you sometimes have to gently interrupt your patient. I know, it feels so counterintuitive, right? But skillfully and kindly redirecting the conversation back to the agenda is one of the best things you can do to make sure the session is productive and really respects their time. So, with our foundation and our structure in place, we can now get to the real heart of CBT intervention, guided discovery. And let me be clear, this is not about telling patients their thoughts are wrong. It's about creating a collaborative process where they can examine their own thinking with you as their trusted guide. And it so often starts with this simple but really profound question. When you see a shift in your patient's mood, a change in their face, their posture, just asking this question opens the door right into their automatic thoughts. Let's see how this works in action with a quick case example about a patient, let's call her Sally, who is struggling with finding a job. So when Sally thinks about getting a job, boom, this is the thought that just pops into her head. I won't be able to handle it. And that single thought immediately triggers her feelings of sadness. And what does it lead to? Inaction. She doesn't even try. Recognizing this link between the thought, the feeling, and the behavior, that's absolutely crucial. Now, instead of challenging her, the therapist kicks off the guided discovery with a simple Socratic question. This gently asks Sally to kind of step into the role of a detective. What facts, what actual data supports this really powerful negative thought? The natural next step, of course, is to explore the other side. So after you've looked at the evidence for the thought, you work together to explore evidence against it. What might she be overlooking or discounting? Remember, this isn't an argument. It's just an exercise in broadening her perspective to include all the data. From there, the therapist helps Sally decatastrophize her fear by looking at the full spectrum, the absolute worst, the absolute best, and then landing on the most realistic outcome. That catastrophic fear starts to lose its power. She moves from I can't to it might be hard, but I might be able to do it. And that, right there, is a huge shift. So we've seen it in action with Sally. Now let's kind of zoom out for a second and look at the core questions that make up this Socratic toolkit. These are the tools you are going to use again and again in your practice. Think of these as your go-to questions. They help patients evaluate evidence, find alternative ways of looking at things, decatastrophize, and really assess the impact of their beliefs. One that I find particularly powerful is asking what advice they'd give a friend. It creates just enough distance that they can often access a wisdom they don't apply to themselves. The progress made in a session is fantastic, but let's be honest, the real lasting change happens between our sessions. And that's where homework comes in. This isn't about busy work. It's about strategically extending the learning from the therapy room right into the patient's daily life. The goals here are very, very specific. Homework is all about bridging that gap between the session and their everyday life. It's where patients actually implement behavioral solutions, where they practice catching their automatic thoughts in real time, and ultimately where they solidify new, more balanced ways of thinking until they become second nature. And this is just a perfect, tangible example. It's not some vague instruction. It's a specific, written down plan. The patient creates a coping card with the new balanced thought that they can use as a tool right in that moment of difficulty. It's practical, it's portable, and it is so powerful. So we've covered a lot: the therapeutic alliance, the session structure, that core skill of guided discovery, and how to make it all stick with homework. Now let's bring it all together and turn the focus back to you and your own practice. So here is my challenge to you. What is the one skill from this masterclass that you will intentionally focus on and practice this week? Will you commit to asking for feedback after every single session? Or maybe experiment with a new Socratic question? Because we all know true learning only happens through application. I'll leave you with that thought to take into your next clinical encounter.